Well, aloha and good morning. It is Monday, June 22nd. We begin yet another week here on the COVID-19 care conversation. I'm Ryan Kalei-Suji, joined, of course, by Yunji Denise. So great to see all of you here as we begin this next week here in Hawaii as we continue our discussion about all the things that are related to COVID-19 in the state of Hawaii as we continue to see our case numbers and count numbers go up. We'll talk a little bit more about that, but of course, we want to first thank our sponsors, the Hawaii Executive Collaborative and Hawaii Pacific Health, for making this conversation possible. Yunji, the governor, is going to be joining us here in just a few moments, as well as another special guest.
That's right. We have Lisa Kimura from Aloha United Way. Aloha United Way. She's here to talk about the ALICE report, which is a financial snapshot of the families in Hawaii, where we place in terms of how many people are struggling. The numbers are pretty staggering. They did this report a number of years ago. They did an updated report just before COVID, and they're going to share those findings with us. So we're looking forward to speaking with her. We're going to, of course, talk to the governor first, and top of mind right now, Ryan, are these count numbers. We had 3 straight days of double digits. Friday, pretty surprising, 27 cases, 14 reported on Saturday, and then 11 new cases yesterday. So we're now at 814 positive cases. Good morning, Governor. Thank you so much for joining this morning. Let us know, what is your reaction to these double-digit case numbers that we're starting to see?
Well, thank you so much again for having me on. I really appreciate this opportunity. Certainly, it's a concern, but it is a concern that we were prepared for. We did anticipate, as we began to reopen the economy, started to allow businesses to reopen and people to get out and about, we would see an increasing number of cases. So, Yunji, when we look at the cases, we are confident in our ability to handle the numbers. Most importantly, we do see that for the most part, they are occurring in clusters. And once again, it is something that personal responsibility and everyone taking personal responsibility can help us stop. We were able to get contact tracers into the area immediately in every single case. We canvassed the surrounding community to identify those that may have come in contact with those who are positive. We do ask them about interactions that they've had and have been able to get out and test those that were exposed and get those people to isolate as well. So, I just want to assure the public that we have been preparing for this. What is different now than the last time we had 3 days of double-digit case numbers is the fact that we have a broader network of contact tracers. We definitely have increased testing capacity, and so we can get the test results within 24 to 48 hours. And we definitely can respond, isolate them. In some instances, as you've heard, it was multiple members in the family who really would not be able to isolate the others. So we moved them into isolation locations so that they wouldn't continue to reinfect others. And most importantly, stress with them about personal responsibility and about really limiting their interactions face to face, which we know is what really spreads the virus.
Governor, how soon after someone tests positive for COVID-19 is that case reflected in these daily counts that we're seeing from the Department of Health? Because, recently we heard last week when we saw some of those rising numbers, some state officials saying that it was because of Memorial Day or the Black Lives Matters protests. And of course, that happened, a few weeks ago. So what is the lag time or sort of that, how soon after someone tests positive do those numbers reflect in the case counts that we're getting?
Certainly, Ryan, when we get notified that from the labs that the test is positive, we do reflect it within 24 hours. We accumulate the test counts for 24 hours, and we will announce them every day at noon. So it is within 24 hours that we make the public announcement. The challenge with COVID is that you can be carrying it for a period of time and be asymptomatic. And we hear more and more reports of case analysis where people are carrying the virus and not symptomatic for days prior to them becoming symptomatic. So, that really makes it a challenge. But clearly, our ability to test in Hawaii and get the results within 24 to 48 hours is a key part of our public health strategy.
Remy Dong has a question. Since the counts are going up, why are we still having the gyms and restaurants open? I know you said that there are more contact tracers and that the state is feeling like they're able to handle the rising numbers. But what is the threshold for having some of those new openings close back down?
You know, certainly we are working with all of the new businesses and entities reopening. We do re-emphasize, and Yunji, if you look at them, all of them are really reopening at half capacity generally. So even the gyms, before you could come and go as you please, you know, now they are requiring reservations, most of them, and they are limiting the number that they put in to the gyms. You know, they are moving the equipment so that they're farther apart and those kinds of activities. So part of the phased reopening, Yunji, is that we know that we'll have to live with COVID-19 for a long time until there's a virus or new therapeutics that give us confidence that most people would fully recover from the illness. And we need to have and work with every single business and entity to change how they operate, because doing it the old way prior to COVID-19 introduces huge risk to our community. And we need for them to say, what does it mean to reduce your capacity by 50%? How are you going to space your customers out? How are you going to keep your employees safe? You know, all of those, I think, are new procedures that everyone needs to do. And so part of this reopening phase is allowing businesses to understand what the responsibility is and then working with them so that they can make improvements as we go along.
You know, a question that I'm sure you get in every interview that you do, and we ask it every week because it's the number one question from people. We'll bring in April's question, the question at everyone's mind: when will you open Hawaii to the mainland tourism with a negative test? Is there any updates on sort of the path forward in reopening Hawaii to mainland or to any trans-Pacific destination?
Yeah, certainly, Ryan. And let me just remind everyone that, you know, we do have a 14-day mandatory quarantine and people can come in, but they will have to quarantine. So we are definitely getting very close in the next day or so to really announcing what the plans would be for going forward. Just really wanted to remind everybody that what we're talking about is in a phased and safe way, beginning to bring trans-Pacific travelers here in a way that does not unduly just put at risk the health and safety of our community. So, you know, working through the details and making sure that we have a system that we feel confident will work and continue to keep our community safe and healthy is what is very, very important. So, you know, we in the next day or so, we'll be making that announcement.
In the paper today, you know, there's a lot of talk about you communicating with the governor of Alaska and perhaps modeling after what they're doing. I don't want to get ahead of your announcement. Well, actually, I do, but
I know you do.
But I would like to know, as much as you can share with us, is the Alaska model the one that we're pursuing? Is it a hybrid of something else? What can you tell us without, of course, you know, stepping on your own toes, if you will?
Sure. Thanks for that question, Yunji. Obviously, we are talking about testing prior to arrival, and you know, we learned a lot from Alaska. Clearly, they gave people options, and most people showed up without taking a test, and it really tested their testing capacity, which is absolutely something that we will not allow to happen here. You know, if you remember, the Alaska situation is so different than ours. We get visitors around year-round and in significant numbers higher than what Alaska would normally see. You know, Alaska tourism is really limited to the summer months, and so they have a very short season that gets a high volume of travelers. But they're only about, even in their peak season, they're only getting about a tenth of the visitors we would have here under normal conditions. And so it is an order of magnitude different. We definitely will benefit from the lessons learned from Alaska, and we'll be incorporating the parts that we think would work here in Hawaii, and really eliminating the parts that we just don't believe will work.
Michael has a question that is an interesting one. What is the status of cruise lines in Hawaii? Are they really staying out until June 2021? We know that a lot of when this pandemic first started out was surrounded around these cruise ships, and the number of cases that we've seen on the cruise ships. Can you give any update on what the status of cruise ships would be here in Hawaii?
Certainly, Ryan, I haven't heard any public or official announcement from the cruise industry. But as you may or may not really recognize, my mandatory 14-day quarantine applies to cruise ship travelers as well. So if they were to stop in Hawaii while we have the 14-day mandatory quarantine, they wouldn't be able to get off their ships until they completed 14 days. So effectively, they would not be able to port, and those travelers would not be able to leave the ship to interact with our community. So that's something that we didn't understand fully at the very beginning of the concerns raised by those traveling on cruise ships. And so they definitely will not be back for a while.
The legislature is back in session this week. Have you been communicating with lawmakers about their recess? Is there anything specific you're looking to from them as they head back into session and they have all that money set aside in the rainy day fund?
Certainly I've expressed to them that having money in the rainy day fund is not helpful at all. And so we've told them that they need to take the money out, or else, we can't support anything that really plows a lot into the rainy day fund. We've had ongoing discussions about what's the best use of the CARES fund. We know that helping with unemployment will help all of the businesses in the sense because they all pay UI insurance premiums, and ultimately will have to pay for any borrowing that we get from the federal government to make UI payments. Obviously, we recognize the safety net kind of needs, food, rental assistance. The mortgage challenge is a lot bigger challenge, and that's a legal contract, and trying to understand how we might be able to support those who are getting behind in mortgage payments is a lot trickier. We are asking the legislature to pass a couple bills that we need. One establishes the Department of Health, gives them the authority to declare a public health emergency like we're seeing right now. And I think most importantly, we're trying to figure out where we can get the revenues to implement a screening and a public health program tied to the quarantine and managing those who are sick. So, we're talking about taking maybe some TAT funds to be able to support that, because we know that the CARES funds run out by the end of the year, and we need to create a sustainable program, a public health program, focused at the airport, but really supporting contact tracing and testing and all of those activities that we now know is so important for us to maintain and expand.
I want to bring in another question here. Henry's asking, how does the state plan to address the loopholes regarding travel bubbles, such as traveling to those states within the bubble when they fly to Hawaii? And maybe it's not a state or another country. And it sort of expands beyond the question of these travel corridors, which we've heard a lot about. How do you close some of those loopholes and some of the things that are happening there?
Yeah, so certainly, Ryan, that's the biggest challenge with domestic travel within the United States. We can't limit travel to the islands. That's something that we've gone to the FAA. I know you've had Congressman Case on board, and he's talked about a bill that he's introduced to have the FAA do that. I've spoken to both Senator Hirono and Senator Schatz, and clearly talked about, that this COVID event has to be much like 9/11. It needs to change how U.S. citizens travel within the U.S. And we need to have the capability to either require pre-testing prior to coming here or some other way to manage. As you know, we've seen the case numbers, you know, California, Arizona, Oregon, Washington State, to some extent, is surging right now. You know, they're seeing the highest case counts that they've seen in a while, and certainly puts us at risk. So we're working on both ends, Ryan. We're focused on what we can control, which is the quarantine, and creating a process for pre-testing. At the same time, you know, we are working with the congressional delegation and others to see how we can change the process for the entire country. We know that there is interest in pre-testing and other requirements to manage movement of people around this country.
There are a number of questions. I know we lost Ryan here, but I'm assuming that he's in there and just refreshing his screen. There are a number of questions here about unemployment benefits and some people who are concerned that the federal plus up, if you will, for unemployment, the $600 a week ends at the end of next month. What are you anticipating when it comes to the unemployment? Well, first of all, we haven't had Scott Murakami on here for a while, so can you give us any sense of what the backlog is like right now? And what are your concerns once that $600 goes away?
Yeah, so a couple things. Clearly, we've gotten and taken the backlog from more than 60,000, I think, for the last times that you might have spoken with Scott, and we're down to less than 15,000. So, you know, we have been focused and chipping away at that backlog, and these are the hardest cases to deal with. As I mentioned last week, you know, there are at least 1,000 of them that are really stuck because the account numbers that were provided by the individuals was incorrect, and it was bounced by the financial institutions. And so we continue, if you completed an application and had provided for direct deposit into your financial institutions and you haven't seen that, clearly you need to contact us at the UI office so we can, you know, make the correction so that you can get the cash flow. You know, we've talked about, and I've talked with many employers who said that, you know, to some extent, the $600 additional that the federal government is providing has made employees not want to get back to work. You know, they're making, some of them are making more money on unemployment than they were earning while they were working. And so, you know, we have looked at that and talked with the legislature about, we recognize that the normal unemployment benefit may make it difficult for people to survive here. And we want to provide additional support. You know, I think the legislature and we agree that we would be providing maybe an additional $100 per week rather than the $600. You know, that adds about $400 a month, which can help with rent and other kinds of expenses for those who continue to be unemployed. And it may give those individuals who have been offered to come back to work the incentive to return to work, because ultimately we want people to return to their jobs.
You know, Governor, we had Mayor Kirk Caldwell on last week, and he sort of floated this idea of maybe having a COVID tax that the state should potentially look at and the legislature look at, and that would be to charge some of these incoming guests and tourists to the islands to sort of.
Yep.
Ryan froze up there, but I think that what he was talking about, you know, is this idea that we would charge basically an entry fee to cover some of these COVID costs. What's your reaction to that?
You know, certainly we've been looking at that and trying to figure out what would be the best way to get travelers to pay for this. We talked about trying to implement an airport fee. Clearly, that would be difficult given the way that we fund our airports. So we are going to, I talked about having a bill in front of the legislature. We are going to be taking existing transit accommodations revenues and directing it into this program that would pay for the screening and other health monitoring that will be required in order for us to bring trans-Pacific travelers back. You know, I think the whole notion of a traveler tax or fee is something that we are still interested in, but we believe it's a lot more complicated than others would imagine.
I know that you're going to be announcing the protocols for how we can lift the quarantine. Do we have a time frame? Are you looking at, I know that the 14-day quarantine is in place until July 31st. Are you anticipating extending that, or are you thinking August 1 is when this new plan begins?
No, I think that we will have the quarantine continue, Yanji. I mean, I think that that is something that will be in place. This new program of testing prior to boarding or prior to coming to the islands is really just a way to, identify those who may be ill up front and ensure that they don't have the opportunity to infect the broader community. So we would provide for a modified quarantine. They would not be subject to quarantine if they can get tested and they're negative prior to getting here.
All right. Well, Governor, I apologize for my connection on my end, and hopefully you guys can hear me. But we do thank you again for your time. We know that you are busy, and just any final thoughts that you have before we wrap things up with you?
No, I just really wanted to thank you and Yanji for having me on. I just want to remind the public two things. One, thank you for all of your support, because we have been successful in getting to where we are. I want to remind everyone that this is a marathon, and we need to continue to honor the physical distancing. Keep your distance, stay home when you're sick, keep your children home when they're sick, because that's the only way that we can manage this disease. The recent spikes really came from, again, gatherings and social interactions. As we restart our economy, which is so necessary, everyone needs to be mindful and take personal responsibility for maintaining physical distancing. Wear their masks, stay home when they're sick, do the things that helps our community.
All right, Governor Ige, thank you so much once again for joining us on this Monday, and we look forward to hearing that announcement soon.
Yes, thank you.
Aloha.
Thank you. So Lake Maddow, I know you're here every week, and she says, so confused. So August 1 with negative test, I'm confused. So the governor obviously indicated that he's going to be making an announcement in the next, 2 days or so. So we do expect details there. But he did say that the quarantine is not going away. It's just that there's a way to waive the quarantine. But for anyone coming in, it's not going to go from the way it is now to sort of carte blanche. You can do whatever you want. It will be with some kind of a testing protocol, and then you get that quarantine waived. In terms of, is it August 1st? Is it August 15th? We really don't know, and we'll wait for the governor to make that announcement sometime midweek.
That's right. And so we will all eagerly await to see what that announcement is. In the meantime, we also want to continue on. We actually have another guest that is standing by, Lisa Kimura, coming to us now, joining us live. Lisa, of course, is with the Aloha United Way, and it's part of our By the Number segment that we sort of set up with the Hawaii Data Collaborative. And Lisa, who is, of course, the Vice President of Community Impact at Aloha United Way. First of all, thank you so much for taking the time to join us. We've heard last week a pretty startling report that was released by Aloha United Way regarding the ALICE program and setup that you folks have established there. Can we start off by maybe informing people on what ALICE is and sort of the history behind it, and then what some of these new figures have really identified?
Sure. Well, thanks for having me, and thanks for the opportunity to share. The ALICE report is actually an acronym. ALICE stands for Asset Limited, Income Constrained, Employed. So in other words, these are individuals, these are families, these are households that are working often multiple jobs, but still just don't have enough to get by. These are people we all know. We ourselves may be ALICE or have lived an ALICE life before, but these are folks that are working hard and working jobs that don't pay wages enough to get by with one job alone. So these are our cooks, our retail, our salespeople, our groundskeepers, preschool teachers, often very necessary jobs doing very necessary work. But with the cost of living that we have here, it's just not enough to get by. And Aloha United Way used this terminology and used this research originally when we released the last report, which was about 3 years ago, to put a name, a face, and a terminology to this kind of population that we all know. And like I said, many of us have lived for as long as we've lived here. And to be able to kind of galvanize a spirit of community effort around changing mobility for people's economic situations. And what we found in the last report, and what has not changed until now, is that about 4 out of 10 families, 42%, are the ones that are struggling to get by. So that means people that are living in ALICE, what we qualify as ALICE, which is just barely meeting the basics to get by, and households that are living in poverty, which is another 9%. And the surprising thing, or the unfortunate thing, since the Great Recession in 2008, is that between 2008 and when we released our last report, which is about 10 years later, we had not seen a recovery to economic conditions that existed prior to the recession. So in other words, many households fell into ALICE or fell into poverty as a result and never recovered. And what we find now with the report that we just released on Friday, it's still status quo. We still have the same number of households living in ALICE and poverty.
Of course, the data that you gathered was pre-COVID, and we've seen massive unemployment. We're talking anywhere from 22% on upwards just in the state of Hawaii. When we look at those numbers, how do you think that will affect the data that you've collected? How many more families are now in this tenuous circumstance?
We have partnered with Hawaii Data Collaborative to help us model, because when we originally did this research, it was, all throughout last year, we had researchers who are very, very expert in this field, working with United Way worldwide, as well as a research advisory committee here in Hawaii that was multi-sector to help provide input on everything from education costs, healthcare costs, cost of living, all that kind of information that helps inform this, and to create the ALICE Essentials Index, which is basically the bare minimum that it costs to live here. Not going to movies, not going out to eat, just basic survival. So that information was very well informed. And what we realized in March, which was the original date that this report was supposed to be released, was that, wow, COVID just hit. We could see right away things were going to change substantially. And at that time, we didn't know yet what it was going to look like, but we did know it was going to be big. So working with Hawaii Data Collaborative, they have helped us with some scenarios to help model based on many, many different factors that continue to change almost every single day. But what we can tell from March until now, as a result of COVID, about another 35,000 Hawaii households have fallen into ALICE or below. That equates to about 105,000 individuals. So this is not a small number. And the impact for families that are struggling with unemployment right now, struggling with a very uncertain future, and of course, there's very, very mixed feelings and results that will come as a result of reopening our state completely. And again, the impacts that that's going to have rippling throughout our community and our economy, but it's not going to recover anytime soon. So it's a very tenuous situation.
One of the things that we know that Aloha United Way has participated in is the 211 program. Can you sort of share what you experienced at Aloha United Way and the volume and some of the needs and requests that were coming in through that hotline that was set up and the partnership with the state?
Absolutely. It's so we've been operating 211 since actually the late 90s. So it used to be, I would say, Hawaii's best kept secret in many ways, because we have a database of over 5,000 programs and services throughout the state. Anybody, anywhere in the state can call. It is operated and funded by Aloha United Way, and we do have partnerships with other contracts that help to fund it. But primarily, it is really through the generosity of donors that helps keep this 211 line open and operating. With that said, the thing that we first noticed when COVID hit, right away the numbers spiked in relationship to people wondering how to get testing. What are the symptoms? What do I do if I've recently traveled? What's going to happen to travel? And so on and so on and so on. We almost became sort of an unofficial tourism bureau, honestly, because at some point we were getting calls from around the world asking about, is Hawaii going to shut down? What do I need to do? And even still today, asking questions related to quarantine and such. But once that huge surge kind of subsided a bit, and now we've sort of stabilized into our new normal, what we are finding, though, is that the number of calls and the types of calls that are coming in, which has been and has continued to be about 600% higher than our normal call volume, are people calling looking for food, looking for housing and shelter, looking for assistance with their rent and mortgage, looking for health care, because many, many people have lost their health care benefits because they've lost their jobs, and also looking for government assistance and assistance with unemployment. And those kinds of areas of need very much track with what we identified in the ALICE report. everything that we identified as a vulnerability, including the fact that our economy is heavily dependent on tourism, including the fact that many of our jobs are low wage and people are dependent on their healthcare benefits to be able to survive. With the removal of these things and the elimination of the jobs, we see the surge in real-time data with the calls that are coming in.
You know, as we look to trying to get out of this economic uncertainty, tell us what can we learn from the ALIS report? I know you talked about how many families really haven't transcended and gotten out of the Great Recession setback. Are we anticipating that for the 100,000 plus people that you just talked about who are now, you know, put more at risk because of COVID?
You know, it's tough to say, and without action collectively, we aren't going to see change. So the real important point that the ALIS report puts forward is that this is a framework to be used to help galvanize the community and to have a collective page for us to take a look at and use real data, real numbers that affect real people. It's not Aloha United Way that's going to solve it. It's not the government. It's not any one entity. It really does take all of us getting together, having a collective framework, and knowing that if we don't work together on public policy changes, if we don't work on thinking about how to diversify our economy, if we don't think about mechanisms for getting affordable goods and services to people, nothing is going to change. And so in order for us to improve, it's going to take creativity, it's going to take collective impact together, and it's going to take all of us realizing that we can't do it alone, but that we have to rely on each other and we have to think together.
You know, I know that you mentioned that, of course, this latest report that was just released does not reflect the COVID counts and things of that nature. When will the next sort of ALIS report be taken, and what might we expect to find in that, and maybe when that might factor in some of these numbers that we've seen?
I think our partnership with the Hawaii Data Collaborative will definitely continue so that we can keep kind of an active eye on what's happening, because the complexity of the information that goes into the report is kind of lengthy, and the systems changes that are happening right now are fast as we see it. We want to make sure that we can stay on top of it, and that does mean, again, keeping our partnership with HDC, and the report itself. Generally, you know, it's every 2 to 3 years that we're planning to come out with it. But absolutely, we keep looking to the idea of continuing to release information as we have it available. And again, the 2-in-1 data that we get really helps to inform things in very real time. That for sure has helped us to inform a lot of decision makers about where the needs are evolving and where we need to put our focus.
If you would like to read the report yourself, I'm assuming it lives on the Aloha United Way's website, and hawaiidata.org. Ryan put that up as well. They've got a bunch of great modeling, not just about the economic circumstances, but also about masks and why they're important to wear and what kind of health protocols are effective. So check out hawaiidata.org and also auw.org as well.
All right, Lisa, thank you so much for joining us and sharing those insights, and really for all the work that you folks are doing at Aloha United Way. I know there's a lot of people in need right now, and we certainly appreciate the work that you folks are doing for the community during this very critical time.
Well, thank you. We appreciate it. We're working hard.
Aloha.
Thank you. Wow, sobering to hear there are 100,000 plus people put into that ALIS circumstance. And when you think about that, those are folks that are, as she said, they're working and they are perhaps one car breakdown, one health emergency, one unexpected crisis away from being, perhaps losing their home or losing, the apartment that they live in. So that is really sobering to hear. We encourage you to head to those websites, read the reports, stay informed, because it's such an important part of our community. A huge sector. These are our friends and neighbors. These are not strangers for sure.
Yeah, and really telling to hear about how the recession continues to impact, and that a lot of people just did not recover after that, and they sort of lived within that same threshold that was mentioned. Only can imagine that number going to be significantly more as we get more information about COVID and seeing the long-term effects that this has had on our economy, as well as people just overall being able to make ends meet.
Yeah, we appreciate you all for tuning in today. Sam says aloha, always grateful for the time. Well, we are grateful for your time. We got to let you know that this is actually our last full week. We are continuing this program until the end of June, thanks to our partners. So that is next Tuesday will be the last show. But we have lots of great guests coming up for our final week, Ryan. We're going to be talking to Leanne Wong from Cocoa Head Cafe tomorrow to talk about what it's like to be a small business owner and open up a restaurant, and what she and some of her colleagues in the restaurant industry are going through. And then we have some other great guests lined up for the week.
That's why we're going to be talking to Lieutenant Governor Josh Green, as well as Ron Kochi from the Senate President, to get an update on the legislature. We'll hear also back from the governor next week. And again, we will sort of end this next week, and we'll be doing a few more different types of things on the platform. We won't be awake completely. You'll still see us in the month of July, just not every day. So we certainly appreciate all of you tuning in. And we still got one more week of highlighting things that are happening here in Hawaii, as well as highlighting some of the good things that are happening right here in our community.
That's right. And we always like to end with a Hawaii hero. This one comes from the island of Kauai. Let's see. And I have it all queued up and then I lost it. There we go. Coming from the Garden Isle, Charlie Iona and Mel Raposo. They host a Facebook live show like this one, but a little different, where it's the Mel and Charlie live show, and they have made t-shirts promoting that show. It's become a really popular platform on Kauai, a place where people can exchange ideas and talk about Kauai specific issues. It's live and scripted. It has some guests. They made these t-shirts with the partnership of Island Athletic Tees. Kirk Correa, actually, of that company, came up with the idea of t-shirts. They've been sent to viewers, purchased actually all around the world, even in Japan. And they raised over $6,000 to support the Kauai Strong Fund through the Hawaii Community Foundation. So we're so thankful for that work. Wonderful action there to sell all those t-shirts, raise those funds, and help their community, not only with the t-shirt money, but also with that platform that they have there, sharing information, because we know right now that is so critical.
That's right, and happening on the neighbor island, and great to see how all these neighbor islands and different communities are coming together and finding ways to get the information out and supporting one another during this time. So we thank you for all that you're doing there, and again, thank you for being our Hawaii hero. We encourage all of you to continue to find your small way of giving back and helping in any way that you can to be your own hero, whether it be in your community, within your family, because these are definitely difficult times. And we certainly can use a little aloha here in our community. Again, we want to thank our sponsors, the Hawaii Executive Collaborative, as well as Hawaii Pacific Health, for making this conversation possible. And we will see you right back here tomorrow with yet another special guest at 10:30. Aloha.
Aloha. See you then.